Hi, I'm Dr. Luke Wells-Smith. I'm here today with Ranvet and I'm from Motion Equine Podiatry Consulting. Today we're going to discuss the key issues that I find with hoof health. Those three things are hoof structure, hoof mass and hoof growth. And to begin with, we're going to go through hoof structure, which is basically the hoof wall, the sole and the frog. So one of the components of hoof structure is the sole, and you can see the sole is formed in this region here. Anything on the under surface of the hoof that we can see exposed around the shoe is basically the sole. And you can see in this horse we've got a nice concave sole, so it's got what we call a solar cup. At different times of the year, horses will maintain their sole and they'll end up with like quite a flat sole. Generally that occurs throughout summer, and then as we get into winter and the weather becomes a little wetter and the ground becomes moist, then what we'll start to find is that solar cup will come back and that flat sole will exfoliate. We can also see the bars that move down towards what we call the sulcus of the frog, which sits on either side of the sulcus, and that's partly part of the hoof wall, but it's also sort of incorporated into the sole. So the hoof wall is another important structure of the foot. The hoof wall protects the underlying soft tissue and the pedal bone that lives inside there. The hoof wall is attached to the pedal bone via the lamellar attachment. Obviously we can't see that externally, but we'll have a little bit of a conversation around the lamellar attachment when we talk about our x-rays. The major component is this outer hoof wall here, and we can see on this horse we've got some small little growth rings coming down. Also it's winter, so we can start to see the waxy periopal start to grow down from the coronary band. This periopal is there to protect the hoof wall from large amounts of moisture, so it's more likely to see it this time of the year. And then we can see as we move down, further down the foot, the bottom of the foot's been rasped or it's worn away in the sandy surface and it's quite smooth. You can see on both front feet we've got these little rings coming down. Those rings are can be fairly benign. It could be things change in season, change in feed, but in some cases like laminitis it can be a little bit of a problem and let us know when we've had an inflammatory reaction within the hoof capsule. Overall, this horse's walls are fairly normal and fairly healthy. We don't have too many superficial cracks. It looks very structural. You can see, obviously the horse has shoes on, so we can see some old nail holes there that'll grow out eventually, but overall the hoof capsules, hoof wall is relatively sound and pretty healthy. Then if we take a little bit of a look, the next structure that we look at in hoof structure is our frog. You can see this frog is a typical sort of winter style frog. There's a little bit of frog that could be exfoliated off. And the important part about looking at the frog is actually looking at the size of it and the shape of it. We can compare the frog from this foot to the other foot of this horse, the other front foot. You can see that this frog is actually quite long, extends a long way forward through the hoof capsule. And look, it's reasonably wide, and when we have a look at the other frog, you'll see there's some subtle differences there. But the frog is an important component of the foot. It provides some sort of cushioning and concussion to the back part of the foot, and then forms part of the digital cushion as well. So now we're looking at the right front foot frog, and you can actually see that this frog doesn't extend as far forward in this hoof, and also the sulcus, the little grooves either side of the frog, is slightly deeper on this side, and that's because this horse has a mismatched foot conformation, which we'll talk about a little bit later. It's got more heel on this foot, so the frog tends to be slightly narrower and slightly shorter than on the other side. One of the areas of the frog that we really need to look at is this central sulcus here. Some horses have a relatively flat sole and flat frog, and they don't tend to have this central sulcus there. But in this horse with this narrow, short frog, you can see we do have a reasonably deep central sulcus to the frog. it's important to keep an eye on that. In some horses, this central sulcus will become quite split, and sometimes it'll go down into the hairline, and we can have some bacterial overgrowth living in there. This horse, it's relatively healthy. It's just important to keep an eye on it. Well, that comes to the conclusion of our short video on hoof health in terms of our hoof structure, looking at our hoof wall, our sole, and our frog. Thanks very much to our great patient today, Eve, and thanks very much for watching.